Hi, I'm Dr. Birkenstock, owner of Skin Body Health. We're going to talk about something very interesting tonight. Well, have you ever thought about after the age of 45, all of my friends seem to get diabetes, or at least a lot of them. And am I at risk for getting diabetes? And how does that risk change over time? And why all of a sudden, as I'm getting the hot flashes in perimenopause, that's that in-between stage, or menopause, that all of a sudden my blood sugar is rising? Could it be related, or is it just total coincidence? Well, we're going to answer that and some of these other questions related to menopause and diabetes today. And if we know what the problem is there an answer that might help? And yes, the answer is there are lots of things that we can do to help. So tonight, an interesting topic, sort of complex and intermingled, but does menopause, and as we begin to go through menopause in our 40s and then trickle into our 50s and beyond, does that lead to diabetes, insulin resistance, hyperinsulinemia, high fasting plasma glucose, diabetic borderline, or pre-diabetes? And the answer is yes, 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 and yes. And let me tell you why. As you know, I'm Dr. Birkenstock, owner of Skin Body Health in New Orleans, Louisiana, and Mandeville, Louisiana. We're also licensed in Alabama and Florida. So while we go there in person, we also serve the United States via Zoom or teleconference calls. So if we can help you in any way, please let us know. We have lots of clients that we serve nationally and some internationally, actually. So tonight we're going to be focusing on menopause and its effects on diabetes. But before that, let's just talk about a little bit about when you're younger. So when you hit somewhere between the ages of 12 and say 14 or 15, you begin your menstruation cycle, or nickname your period. Well, you may have noticed that a couple of days before your period and right in the beginning of that cycle, you were ravenous for chocolates and sweets and candies and ice cream and brownies or sweet tarts or whatever else may be the little comfort sweetie food that you like. Well, what was it that was doing that? Was it just something in your mind? Did you have no self-control? Or was something going on? Well, I'm here to tell you there was. So it wasn't all your fault. You're grabbing for that chocolate bar or those sweet tarts or Twizzlers, and the reason is because your progesterone goes up before the cycle starts. When the progesterone goes up, the serotonin goes down. The insulin in your body isn't used appropriately, and there's more sugar floating in your blood. And even though you're not a diabetic at all, that little bit of change in hormonal milieu, hormonal balance, gets you attracted to sweets. So the serotonin goes down. That's the happy hormone in the brain, and it starts screaming, I'm not happy, I'm getting sad, I'm getting confused, I'm getting overwhelmed. What to do? And we start grabbing for the sweets. So it's natural that progesterone goes up and serotonin goes down. The insulin gates get closed on some of our cells, not all of them, unless you're diabetic. And the body starts wanting some sweets and sugars, so it goes after typically things like chocolates and sweet tarts or tutti fruttis. It may be bread, rice, pasta, potatoes, and sugar, ice cream and chips, but just in general, it goes after carbohydrates. So I bring that up because progesterone is going to play a very different role when we talk about menopause. But right now we're talking about in the beginning when you're cycling as a teenager and a young adult. So then we go over to when clients would ask me about the Depo-Provera shot, should I get it? When I started counseling them 20 years ago, please don't get the Depo-Provera shot. We're still trying to connect the dots. But what we do know is that people on the Depo-Provera shot, which is a progesterone derivative for birth control, they get fat. And we don't say, well, just because they went on Depo-Provera birth control and they said, woohoo, I can go out and have a party, they got fat. No, it was a lot more than that. when your progesterone is up high, and if we're giving you the Depo-Provera shot full of progesterone that last 90 days, your cravings go through the roof. You're ravenous for sweets, chips, ice cream, chocolates, tutti fruttis, anything. And you thought it was you. It wasn't you. It was the Depo-Provera shot. It was the progesterone shot. Because progesterone at superphysiologic levels or extra high levels causes insulin resistance, which means the insulin gets out and tries to handle the sugar, but the insulin gates close on the cells, so you're resistant to your insulin, so the insulin can't mop up the sugar mess, and that leads to increase in blood sugar, and it leads to increase in visceral or abdominal fat, thigh fat. So fat surrounding our organs is called visceral fat. That fat secretes proteins, RPB4. You don't need to remember that. Just know that the visceral fat, the fat cells secrete certain proteins, and those proteins shut the gates on insulin, and the blood sugar goes up, the insulin resistance goes up, and we get fatter. As we get older, if this continues, we then get diabetes. So I digress. That form of birth control is bad. And now let's talk about what happens in menopause with the progesterone. So when we go through perimenopause and then menopause, or the deadly tubal ligation. If anybody's had their tubes tied, tubal ligation for birth control, connected to your ovaries down by your uterus, you know, quite shortly thereafter, you went, can't sleep. Don't know why, can't sleep. Just can't sleep. And an OBGYN told you, it's new motherhood, or you're just adjusting to the tubal ligation. It will all be fine. The reality is they didn't know back then. I've had a tubal ligation myself, 1996. And at that time, I went to my OBGYN and said, I'm really having a problem sleeping. And he says, honey, it's because you've got 3 babies. They're all under the age of 4. You know, you're just getting used to motherhood. It'll be fine. When in fact, what we now know is when you have a tubal ligation, when your tubes are tied, then the progesterone can no longer circulate properly. Without the progesterone is your sleep hormone. So your sleep becomes erratic. And you may or may not start with hot flashes, and you certainly get a change in your cycles or periods. Again, I digress. So, whether it's from the tubal ligation or perimenopause, the beginning stages in your 40s and such, where your hormones sort of hiccup a time or two and don't put out exactly correctly, or whether it's menopause, the progesterone levels go down, 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 and down. Well, that's not causing insulin resistance, because a few minutes ago I said high progesterone causes insulin resistance. But what does it cause? When that progesterone goes lower and lower and lower, then without the progesterone, it doesn't send out the signal for melatonin and to go to sleep peacefully and to sleep well, rest well, wake up well. So we start flipping the covers on and off. We're restless. We may or may not start with a hot flash from progesterone. Then estrogen is going to also give us a hot flash as well. So indirectly in menopause, because progesterone is low and we're not sleeping adequately, the decrease in sleep leads to a pop in cortisol, the stress hormone. I'm stressed, I'm not sleeping. And that stress leads to insulin resistance, which leads to more sugar in the blood, and voila, you got it. Increased blood sugar, and then as we go on in time, prediabetes and then diabetes. So that's Mr. Progesterone. So please find an alternative way. If you're younger and looking for a birth control means, please don't do the Depo-Provera progesterone shot. You're asking for all kind of unwanted things. Now let's turn over to another part of our menstrual cycle that is important. And then as we go into menopause, becomes even more important because of the changes that it causes. So as I said, right before that period, that progesterone surges and we're grabbing for cookies, candies, chocolates, and sweet tarts. And then we start the period, and a couple of days into, the estrogen starts increasing, and that simmers down. And we actually feel more in control. And all those crazy mood swings get a little bit better. And that's good. with that increase in insulin, that increase in estrogen, we actually have improved insulin sensitivity. So we can mop up all that sugar we were eating plus some, and we'll put it into the fat storage cells, and we'll put it into the muscles to use it for later. It's stored as glycogen. It's not causing anybody any harm. It's just like putting something away in the closet. You don't need it right now, and everything is good. So that excess estrogen can actually lead to low blood sugar or hypoglycemia. So if you ever get shaky in between meals and you're on your cycle, it's probably just because you threw out a whole bunch of estrogen and you got a little hypoglycemic or a little tiny bit of low blood sugar. So as life goes on, and then we get to perimenopause where the hormones start hiccuping, and then to menopause where the hormone levels get very low and they continue very low for the rest of your life, that decrease in estrogen then does a bad thing. That increase in estrogen used to do a good thing, and now that decrease in estrogen in perimenopause and menopause does a bad thing. When that estrogen decreases, it closes the insulin gates in the fat cells and the muscle cells, so that once the insulin gates are closed, all this lovely insulin comes out to help absorb the sugar from the bread, rice, pasta, chocolate, ice cream, chocolate lipty-dipty martini, and all that, and the sugar can't get in the cells, because when the estrogen goes lower, the insulin gates close on the receptors on the cells, so the mop can't get to the bucket. It can't dump out that sugar, so that sugar floats around the blood. So we get insulin resistance, we get prediabetes, we get high blood sugar, and then we get diabetes. So yes, menopause, through our hormones, that's one thing that can lead to insulin resistance and diabetes. Now, what about fat? Well, as we get older, our metabolism goes down by degrees and percentage points every year as we get closer to menopause. In every decade of life, the metabolism shifts down and shifts down and shifts down. That's a bad thing. So you're eating less, you're not metabolizing the fat, sugars, and calories more. Matter of fact, you're metabolizing them less. So what happens is we're gaining more visceral fat or fatty fat, and we're losing muscle. So you would have to double your exercise and eat half of what you're eating to be that sleek, former, youthful self that you were. You can do it, and many, many do. But it is a bit of a challenge. We're losing muscle mass and we're gaining fat. So that visceral fat that goes in that lower tummy area that we tend to see during menopause, and then sometimes people are seeing in the buttocks and or thighs. That visceral fat, through a different set of proteins, secretes a bad protein. And that visceral nasty fat secretes these bad proteins, and through another gateway channel, another highway. There are many highways, right, to get to a major city. So we talked about estrogen and progesterone as some of the highways to insulin resistance. Now we've got this fat, this visceral, nasty abdomen fat that we didn't have before. Doesn't look good. We don't like it. We want it gone. And he's out there secreting these proteins that are increasing the problem, increasing the closing of the insulin gates in the cells, which is causing an increase in insulin resistance and blood sugar. So now that we know a few of the things that are breaking down the chain of goodness, what can we do to cure this? Well, I'm going to get into that in a moment. We're going to talk about food, and then we're going to talk about the other 8 things that we can do. So if you don't know about us, please, our YouTube channel is Dr. Birkenstock Skin Body Health. I've been talking to my community for about the last three or more years. We talk about anti-aging, menopause, andropause or older age for men, erectile dysfunction, hair restoration, skin rejuvenation, anything to do with anti-aging. We're here and we're happy to help you and share with our community. You can review any of our older webinars on our YouTube channel, Dr. Birkenstock Skin Body Health. Please like and subscribe, because we may be able to help some of your friends and your family. And by subscribing, it helps us share and grow our community. We're just here to help. If you'd like to tag us or email us, our email is info@skinbodyhealth.com. Real simple. info @skinbodyhealth.com. You can also text us at our main number, 985-727-7676. And I'll repeat that for you again a couple of times throughout the webinar if you want to grab a pen. 985-727-7676. So click the link in the description below and you can go to our store, skinbodyhealth.com. Why do you need to go to the store? Because I'm about to tell you about our Control Your Sugar bundle. It normally retails for $150. We'll be having it for $130 for the next month. $130. It contains our Sugar Smart. Our Sugar Smart has got a bunch of herbs like fenugreek, berberine, cinnamon, and other things that block sugar in the absorption process. All natural. So it helps mop up some of that nasty sugar that might be floating around the blood. Chromium, a wonderful herb. Now, chromium works by also slowing down sugar absorption and the metabolizing of sugar so that you can get rid of it more easily. In conjunction with that, in a very similar process, is R-lipoic. So Chromium Calm, Sugar Smart, and R-lipoic is our sugar bundle. Totally safe for diabetics. You would not stop or change any of your medication, but this will help with the metabolism of sugar, carbohydrates, bread, rice, pasta, potato, crackers, pretzels, cookies, all of the like. So that's our bundle. It retails for $150. For the next month, it'll be marked down to $130. That is Control Your Sugar bundle. A couple of the other herbs and vitamins that you should know that absolutely help with sugar metabolism and hormonal dysfunction. Magnesium, and you'd want to get an elemental magnesium. So we've got 3 different types of magnesium, not magnesium oxide. That simply helps with bowels and gives you diarrhea. This actually helps with heart health, brain health, gut health. It helps you sleep at night. So magnesium is amazing, and it helps with blood pressure too. Vitamin D is wonderful in terms of helping prevent and help with diabetes and sugar control. Our Vitality is a great multivitamin that's got all of your B1, 3, 5, 6, and 12. Those B vitamins, along with so many other things that are inside, magnesium and such, they hit along all of the processes that help with sugar digestion. B vitamins, D vitamins, chromium, cinnamon, all so very, very important in the sugar process. And last but not least, which I will get into in a moment, if the thyroid's sluggish, you're absorbing more glucose, meaning sugar. So something that supports the thyroid in a very gentle way, like our Thyroid Enhanced product, would be something you might be interested in. So everything may not be what you need, but if you're having a little bit of a blood sugar issue or you've got frank diabetes, our Control Your Sugar bundle is the bundle for you. Let me continue on. Oh, and if you're listening from TikTok or Instagram, please like and share. The first 3 people tonight that like and share are going to get one of our multivitamin Vitality sent directly to them, no shipping charges. So please, whether you're on TikTok, Facebook, Instagram, or YouTube, like and share. We'd love to send you out our flagship product, Vitality. It's our major multivitamin and mineral, and it works fantastic. Let me go on now to tell you a little bit about what diet you can do. And it's more of lifestyle. I hate the word diet because it makes you feel like you've done something wrong and now you've got to go on a diet. You've got to be punished on a diet. Diet just really means what we're putting in our mouth. So what kind of lifestyle menu would we want to do in terms of helping to keep us feeling full, decrease cravings, even with, if you're a young fertile woman with all these progesterone, estrogen shifts, or if you're a menopausal woman, you're still getting hormonal shifts and you're still getting a lot of cravings from vitamin, mineral, and hormone deficiencies. So what I would be recommending is fresh fruits and vegetables. Like here we're seeing grapes, oranges, and I would also recommend berries and apples. Nuts. Nuts are wonderful. They're a healthy fat, so you're getting the good fats which keep you full. They're full of fiber, and you're not getting the nasty fats. Fats that are solid at room temperature Please don't be fooled. They're not entirely good for you. Every once in a while, there'll be an oil that comes in vogue. If an oil is thick or fat or solid at room temperature, in most terms, it is not good for you, contrary to popular belief. Olive oil, virgin olive oil, is amazing. It's amazing for your skin. It's amazing for your cholesterol. It'll keep you feeling full, and it's so much better than butter. Don't use butter on food. Use a little bit of olive oil. Cinnamon. Cinnamon is your best friend. Sprinkle him on everything. On your coffees, on your teas, in your yogurts, cottage cheese. Cinnamon blocks the absorption of carbohydrates, and it's so good for you. So sprinkle it on. If you got some fresh cinnamon, even better. Fish. So we love our sardines, mackerel, tuna, and salmon. Those fatty fish fill us up, feed our skin, keep it looking moisturized, feed our hair, our nails, and it helps with keeping insulin resistance at bay. It helps with blood sugar. More nuts and beans. We can't forget about the beans. If you soak your beans, some of the untoward benefits of beans that we don't like in the aftermath of eating them can be calmed down. But red beans, lentils, white beans, all beans are absolutely wonderful for you. So consume them, eat them. Don't be shy to eat your beans. Apricots, broccoli, cauliflower, cucumber, all of your green veggies, absolutely wonderful. What you want to avoid in any lifestyle menu is your processed foods. So your Cheez-Its, your potatoes, your crackers, okay? Those are the things that are so bad for us. Anything that you're going to open out of a box or pop in an oven and eat in 5 minutes, whatever little meal in a box, they're totally full of processed foods. They've got nitrates, nitrites, all kinds of food preservatives and additives that absolutely wreak havoc on your hormones, your abdomen, your gut health, and they're just not good for you, and they're going to increase insulin resistance and send you on a faster track to increase blood sugar and diabetes. So we don't want to do that. What we want to do is feed ourselves well with a good diet and take our supplements that we know will help. Our chromium, our sugar smart, that's got berberine, fenugreek, and other wonderful things. Our R-lipoic, that's the sugar bundle. You got your vitamin D, your magnesiums. You've got your Vitality, which is full of all the B vitamins. The B vitamins, hands down, B3, B6, biotin, B12, block sugar absorption. And last but not least, that good old thyroid guy. If your thyroid's totally normal, no worry, you might not need that supplement. But if you've got a little bit of a sluggish thyroid or you're hypothyroid, the manganese and other vitamins in here are going to help. Another quick hint. If your thyroid is sluggish, the Brazil nuts, which are those darker, bigger nuts, 1 or 2 of those a day are very beneficial for the thyroid. And you want to stay away from your soy products. Soybeans, edamame, soy sauce, very bad for the thyroid gland, and actually estrogen as well. So soy, not our best friend in any form. So what else can we do besides lifestyle menu? We can exercise, even 30 minutes a day. And if you tell me you don't have 30 minutes a day, I get it. Give me 5. Don't think a little something doesn't count. It all counts. If you can give me 30 minutes a day, walking, running, bicycling, jumping on a little mini trampoline in your house, it all counts, it all works. When you do that activity, it increases the ability of insulin to respond. It helps open those gates that were closed and lets the sugar in the cells and out of the blood. When the sugar's in the blood, it's causing havoc, it's causing damage to major organs all over your body. Your eyes, your heart, your brain, your feet, your nerve endings, so many things, your kidneys. Sugar in the blood, bad thing. We don't want it. So first we said lifestyle menu, get the junk out. Second we said exercise. Third, DHEA. DHEA is a hormone. It's a very long word, so I won't bore you with it. But the DHEA, you want to get that supplement if you're in menopause and you get tested and your DHA is low. Low DHA, again, I know I sound like a broken record, increases insulin resistance, increases blood sugar in the blood, not where it's supposed to be. So if you supplement with DHEA, you're going to trim down that menopause belly, and you're going to increase the ability of your insulin to respond, which is going to decrease your blood sugar. So DHEA, a good friend and giant. The thyroid, have your doctor check your thyroid. If your TSH or your free T3 is sluggish, first and foremost you want to get on a little thyroid support vitamin product. And then if it's above a 2.5 and you're getting more sluggish, go to a physician that will help you. We treat thyroids all day long, and we don't wait till they get way out of score. And then we test them every 3 months to make sure we're on target, so that you feel good every day of the week and not just occasionally, because you want to feel good all the time. The next thing I would talk about is stress. So we all get stress in one form or another. Whether it's great stress, I'm getting married, or whether it's bad stress, oh, I'm getting a divorce. Either way, stress is stress, and stress causes an increase in cortisol. Cortisol is that bad hormone in the body. It's great for fight or flight. So when a tiger was chasing you, it was great to let you run away real quick. It would release all the sugar in the blood so you could run fast or fight or flee or do what you needed to do. Great in the caveman ages, horrible today. So you get stressed, or your boss screams at you at work, the cortisol goes up. The fight or flight turns on. All the sugar starts ramping. You get moody, you get foggy headed, then you can't do your work right, and all these things are increasing insulin resistance, pre-diabetes, blood sugar, and so on. Bad thing. So we want to calm down. We want to meditate. Anybody can go to YouTube these days and press YouTube and press search meditation. There's 5 minutes, 10 minutes, whatever. There's yoga on YouTube. There's yoga on Netflix. There's yoga at the yoga places. Go for a walk. Go see nature. Find some things to calm down your stress. Might be as simple as a hot bath, but do that for yourself. When you pull down your stress, you pull down your cortisol, you improve your health and your blood sugar for life. Water. Water is a magnificent element. Get your water in. When you're flushing your kidneys with a lot of water, it flushes the sugar right into the toilet. And that's the very best place for that sugar to be when you don't need it. Floating around the blood is going to cause you problems and damage your organs. Cinnamon I touched on before. That great little gentleman, cinnamon. Mr. Cinnamon slows down carbohydrate metabolism, so sugar metabolism. So as it's slowed down, it doesn't dump into the blood. When it dumps in the blood, that's what causes this problem. So put cinnamon in and on everything that you can. Sleep. Sleep is a big one. So sleep gets affected in several different ways as we get older. When we're older, that decrease in progesterone, whether because they cut our tubes, a tubal ligation for birth control, or progesterone is going down naturally because we're in perimenopause or menopause, or we might just have a progesterone deficiency whether we're older or younger. That gives us very erratic sleep. We're not getting the proper pulses of other hormones like melatonin. We're not sleeping. When you get up with sleep deprivation, that turns on what? Stress and cortisol. Boom. So, decrease in progesterone can cause a sleep disorder as well as decrease in estrogen. So we decrease in estrogen, what happens? I'm hot. Hot flashes. You wake up in the middle of the night, you're throwing off the covers, you're sweating. 10 minutes later, you're sweating and the sweat evaporates, then you're cold. You're pulling the covers back up. Covers go up and down. You're getting the upper arm aerobics. Yeah, the upper arms are looking better, but guess what? You're a mean dog when you wake up because you have not slept all night. It's not good for you. So sleep deprivation causes that increase in cortisol, which leads to that stress and that increase in blood sugar like we were talking about before. So all in all, what can we do? We can take our supplements to bring down the problem. And last but not least, hormone replacement therapy. So for all of my ladies, of course, check with your healthcare physician, but I certainly recommend bioidentical hormones. A little bit of progesterone cream, just the right amount, a little bit of estrogen, testosterone, DHEA if you need it. The perfect hormone cascade, the orchestra of hormones. It's the easiest thing in the world to do, and you get to sleep well, you get to bring your blood sugar down, and you get to feel better every day of the week. I don't know about you guys, but I'm fighting aging every step of the way. I want to look great and feel great every day of my life. Let me help